Now, let's get a closer look. The penis is composed of three cylindrical columns of erectile tissue, which are bound together by a dense fibroelastic layer called the tunica albuginea. In this very low power transverse cross section of the penis, the upper two columns are the dorsal corpora cavernosa of the penis, and the lower column is the ventral corpus spongiosum, which also contains the penile urethra. At the distal end of the penis, the corpus spongiosum expands to become the glans penis. The tunica albuginea is surrounded by a layer of superficial fascia that contains connective tissue, prominent blood vessels, and nerves. The dorsal side of the penis, which is the top side of this image, typically has the major blood vessels present, whereas the blood vessels within the columns of erectile tissue are significantly smaller. Surrounding the superficial fascia is the outermost sheath of penile skin, which can only be partially seen in the upper left of this image. The penile skin moves freely over the underlying tissues due to the loose hypodermis. Unless circumcised, it extends over the glans as the prepuce, or foreskin, which acts as a retractable protective fold of skin. If we take a closer look at the corpora cavernosa at 10 times magnification, we can see that the tissue is highly vascular, with a lot of red blood cells visible within the wide and irregularly shaped vascular sinuses. These sinuses are surrounded by walls or trabeculae that contain mostly elastic connective tissue and smooth muscle. If we zoom in a little closer, we can see a few cross-sections of smooth muscle that stain darker than the surrounding tissue. The sinuses are supplied by constricted, thick-walled arteries and arterioles called helicine arteries. As their name suggests, the helicine arteries are normally coiled when the penis is flaccid. But during an erection, following the parasympathetic stimulation, the smooth muscle surrounding the sinuses and arteries relax, causing the arteries to dilate and straighten out. This will lead to an increase in blood flow to the cavernous spaces, resulting in engorgement of the sinuses as well as compression of nearby veins, which helps further enlarge and maintain engorgement of the erectile tissue. Moving to the ventral corpus spongiosum, you can see that the erectile tissue looks very similar to the corpora cavernosa, except it contains the urethra in the middle. The corpus spongiosum also has a tunica albuginea that's more flexible or extensible. This allows the corpus spongiosum to expand a little more during an erection, which will help decrease compression of the penile urethra. Zooming in further, we can see more clearly that the urethra is also surrounded by a number of urethral glands called the mucus glands of Littré, and they are ducts that release a clear mucus directly into the urethra during an erection. If we take a closer look at the urethra, we can see the lining of the urethra better. The majority of the urethra is lined with pseudostratified columnar epithelium, which can be seen in this image. But the lining will be different in certain portions of the urethra as well. For example, the prostatic urethra has transitional epithelium. And distally, at the opening of the urethra, or urethral meatus, the lining changes to stratified squamous epithelium. Alright, as a quick recap, the penis contains two dorsal columns of corpora cavernosa and one ventral periurethral column of corpus spongiosum. All three columns contain erectile tissue that is comprised of highly vascular cavernous sinuses, smooth muscle, and helicine arteries. The urethra is primarily lined with pseudostratified columnar epithelium. Now, let's get a closer look. The prostate gland is a large and dense exocrine gland that's responsible for secreting a white alkaline fluid that makes up about 30 to 50% of the seminal fluid volume. It's the largest accessory sex gland in the male reproductive system, measuring approximately 3 centimeters in length and width, with a height of 5 centimeters. The average weight of a normal prostate gland is about 11 grams. Due to its similar size and shape, it's sometimes compared to a walnut. The gland surrounds the most proximal portion of the urethra, or prostatic urethra, just below the bladder and consists of 30 to 50 branched tubuloalveolar glands, such as the one seen in this low-power image of the prostate. The glands all drain into converging ducts that eventually empty into the prostatic urethra. The alkaline fluid that's secreted by the prostate gland also includes various small molecules, fibrinolysin, citric acid, and the clinically important prostatic acid phosphatase, or PAP, and prostate-specific antigen, or PSA. Normally, only a small amount of PSA will leak into the prostate's vasculature and circulate in an individual's blood. But a high level of circulating or serum PSA is a sign of abnormal prostatic tissue, which could be caused by prostate cancer, inflammation, or benign prostatic hyperplasia. Because of this association, a PSA serum level is often used as a tumor marker for prostate cancer. And even after a patient has had their prostate cancer removed, PSA is used to monitor for a possible recurrence of the prostate cancer. PSA and PAP immunostains can also be used on tissue samples to assist with the diagnosis of prostate cancer, such as with this section from a lymph node, where a PSA stain is highlighting a metastatic prostate adenocarcinoma in brown. Similar to this image at 40 times magnification, the prostate will have glandular structures called acini that are surrounded by supporting fibromuscular stroma. Each acinus has two layers of cells, an epithelial layer and a basal layer. The glandular epithelial cells can become hyperplastic and consist mostly of simple columnar and cuboidal cells, with some regions having pseudostratified columnar epithelium. The basal layer consists of smaller stem cells that rest on the basement membrane. The basal layer will not be seen in prostatic carcinoma. There are also neuroendocrine cells present, but they aren't easily identified with an H&E stain. With age, the acini have a higher probability of accumulating thick secretions that form hyaline spherical masses or concretions called corpora amylacea, which can be seen in these three alveoli. They can vary in size, but typically have layered or lamellated bodies that can be seen under the microscope. Over time, they may become partially calcified as well. The corpora amylacea are normal findings in the prostate and can be seen in normal lung tissue as well. The prostate gland is also divided into four main zones: the periurethral, transitional, central, and peripheral zones. Also, the anterior surface of the prostate consists of a dense fibromuscular stroma made of irregular connective tissue and smooth muscle that contracts during ejaculation. However, the prostate doesn't have a true distinct capsule itself. The central zone is the area that surrounds the ejaculatory ducts and comprises about 25% of the prostate's glandular tissue. The peripheral zone makes up 70% of the glandular tissue and surrounds the lateral and posterior sides of the central zone. This is the zone that's palpable during digital rectal exams, and is also the zone that's most susceptible to prostatic carcinomas as well as inflammation. The transitional zone comprises about 5% of the glandular tissue and contains the mucosal glands. This is the zone that undergoes hyperplasia in older individuals with benign prostatic hyperplasia, or BPH. When compared to a normal prostate's glandular epithelium, we can see that a prostate with BPH has significantly increased number of columnar epithelial cells that protrude further into the lumen, particularly in the upper right of this image. Hyperplasia of the supporting tissue or stroma can also be seen with BPH. Even though BPH leads to an increased amount of prostate tissue, it does not lead to prostatic carcinoma. The hyperplastic tissue compresses the prostatic urethra, causing difficulties with urination. And finally, the periurethral zone is a small zone surrounding the urethra, which contains mucosal and submucosal glands. As BPH progresses, this zone's stromal components may also increase in size and contribute to urethral compression. Although the different zones are not clearly separated histologically or anatomically, they are important clinically due to their associations with different pathological processes. Alright, as a quick recap. The prostate gland is a large, dense exocrine gland responsible for secreting a white alkaline seminal fluid that contains various molecules, fibrinolysin, citric acid, PAP, and PSA. The gland consists of branched tubulo-alveolar glands and is divided into 4 zones: the periurethral, transitional, central, and peripheral zones. Prostate cancer is most closely associated with the peripheral zone, and BPH is typically associated with the transitional zone. Each zone has glandular epithelium that consists mostly of simple columnar or cuboidal cells, and a basal layer of stem cells that rest on the basement membrane. Older individuals have an increased number of corpora amylacea, which are hyaline spherical masses within some alveoli that may partially calcify over time. Now, let's get a closer look.
Testes, or testis when singular, is responsible for the production of sperm, which is called spermatogenesis. The testes also produce sex hormones, mainly testosterone. The male genital ducts carry spermatozoa and liquid from the seminiferous tubules in the testes all the way to the penis. The genital ducts can be split into 2 groups: the excretory genital ducts and the intratesticular ducts. The intratesticular ducts include the straight tubules or tubuli recti, redi testis, and efferent ductules. And the excretory genital ducts include the epididymis, ductus or vas deferens, and urethra. This very low power image is a sagittal section of the testis, which also includes the head of the epididymis, located posterior and partially superior to the testis. The epididymis is a single, long, convoluted duct where the spermatozoa accumulate and continue to mature even further, including the development of motility. Accessory glands, such as the seminal vesicles and prostate gland, secrete seminal fluid that provides lubrication and nutrients for the spermatozoa. The seminal fluid is also slightly alkaline or basic. This alkalinity helps protect sperm and prolong their life after they've been deposited in the acidic environment of the vagina. Surrounding each testis is a thick capsule of connective tissue called the tunica albuginea. The connective tissue extends inward from the posterior side of the testes and separates the seminiferous tubules into about 250 incomplete pyramid-shaped lobes. Each lobe contains 1 to 4 highly coiled seminiferous tubules. Now, if we zoom in all the way to 40 times magnification, we can see the individual seminiferous tubules, which have a germinal epithelium that's responsible for spermatogenesis. In this one image, we can see the various stages of spermatogenesis. The spermatogonium are the undifferentiated germ cells that are mainly found along the periphery of the germinal epithelium, against the basement membrane. These cells are round, with a large round nuclei and pale cytoplasm. As the cell differentiates, it moves towards the central lumen of the tubule. The stages of differentiation can be identified based on subtle differences in the shape and staining of the nuclei. The next stage, or cell type, is the primary spermatocyte. These cells can be found at various levels between the basement membrane and the lumen, but they can be identified by their bigger cytoplasm and large nuclei that have thin threads or clumps of chromatin around them. The secondary spermatocytes arise from the primary spermatocytes, but they're rarely seen in images because of how quickly they divide into 2 haploid spermatids. The early spermatids can be identified by their smaller size compared to spermatocytes and their very round nuclei. They continue to get smaller as they become late spermatids with small pointed nuclei, which is the last stage seen before finally becoming mature spermatozoa. Throughout the germinal epithelium, Sertoli cells are also present, which are large columnar cells with pale euchromatic nuclei and prominent nucleoli. These cells provide nutrition and mechanical support for the spermatogenic cells. The Sertoli cells also secrete two hormones, inhibin and activin, which provide positive and negative feedback to the pituitary for FSH secretion. In this image, portions of the seminiferous tubules can be seen, but there are also Leydig cells, which are typically found between the tubules in the interstitial space. Leydig cells are large, round, or polygonal cells with round nuclei and often have an eosinophilic cytoplasm because of the lipid droplets that they typically contain. Also in this image, we can see the spindle-shaped nuclei of myoid cells surrounding the seminiferous tubules. The contractions of these cells help move the spermatozoa forward within the seminiferous tubules to eventually reach the next set of ducts called the straight tubules. The spermatozoa will continue to travel through the reedy testis and efferent ductules to reach the epididymis. If we take a look at a cross-section of just one duct of the epididymis, we can see that the epithelium consists mostly of pseudostratified columnar cells called principal cells. These cells also have long microvilli that extend into the lumen called stereocilia. The epithelium also includes basal cells, which are the round stem cells found along the basement membrane. Surrounding the epithelium is a layer of smooth muscle. This muscular wall gradually increases in thickness towards the tail or distal portion of the epididymis. Spermatozoa can also be seen in this image within the lumen of the duct. The peristaltic contractions of smooth muscle and stereocilia movement both help the spermatozoa move forward within the epididymis. The distal end of the epididymis leads to the ductus or vas deferens, which is a thick-walled muscular tube that connects the epididymis to the prostatic urethra. Similar to the epididymis, the smooth muscle surrounding the lumen produces peristaltic contractions. This lower power image shows just how thick the surrounding smooth muscle is in comparison to its lumen. Strong contractions are needed to expel its contents quickly into the urethra during ejaculation. Surrounding the ductus deferens, we can also see some connective tissue, adipose tissue, arteries, and veins. Together, they comprise the spermatic cord. If we zoom in closer to the smooth muscle at 20 times magnification, we can see three distinct layers of smooth muscle. The inner layer and outer layer are arranged longitudinally, which is why they both have muscle fibers that look round in this cross-section. The middle layer is the thickest layer and has muscle fibers that are arranged circularly or circumferentially around the ductus deferens. These muscle fibers look long in comparison because they're arranged along the same plane as the cross-section. Now, let's take a closer look at the epithelium of the ductus deferens. Similar to the epididymis, the epithelium consists of principal cells, which are pseudostratified columnar cells with stereocilia, and there are also basal cells along the basement membrane. The most noticeable difference seen in the ductus deferens are longitudinal folds that allow the duct to expand during ejaculation. The distal end of the ductus deferens on both sides dilate right before reaching the prostate. This portion is called the ampulla of the ductus deferens and is also where it's joined by a duct from the seminal vesicles and together they form the ejaculatory ducts. The ejaculatory ducts from each side then combine and drain into the urethra within the prostate. The seminal vesicles are a pair of highly coiled exocrine glands that secrete the majority of the seminal fluid and nutrients for the sperm. If we increase the magnification to 14 times magnification, we can see that they're surrounded by two layers of smooth muscle. The mucosa of the seminal vesicles has many convoluted cross bridges, as well as folds that project into the lumen. Though seminal vesicles are not meant to store sperm, spermatozoa are often found within the lumen due to reflux from the ampulla. Zooming all the way to 40 times magnification, we can see that the epithelium consists of pseudostratified columnar cells, as well as some regions of simple columnar cells. The lamina propria, seen mostly on the right, consists of collagen, elastic fibers, and smooth muscle.